Welcome to my channel. This is Khali Reed. I'm a certified registered nurse anesthetist and injector at KCSF Med Spa. So I'm here to show you how scalp block is done. We combine PRP with NAD for hair rejuvenation. We have a lot of patients requesting this service, and when I give the PRP, I do scalp block. When you have the scalp block, you have no pain. So some of you know, if you had this procedure done, it's painful, and we can get this done pretty easy. And here you go. Enjoy. Make sure to like and subscribe to my channel. Thank you. Okay, so I have the PRP ready and I'm ready to inject. The patient was cleaned before, so I'm using lidocaine 2%. As you can see right now, I numbed the skin first with the lidocaine. Then I advanced the needle towards supraorbital nerve. This is called supraorbital nerve block. Right before I injected, I aspirated and I gave 1 cc to medial to the nerve and 1 cc to the lateral to the nerve. I hold my finger, lifting the medication, putting pressure in the orbital socket, just so my lidocaine ends in a certain areas that I want to block. Specifically, I want to block the supraorbital nerve. Now, this is called supratrochlear nerve block. Same concept. We numb the skin first. So that's where all your pain receptors are. So we numb it. Then we advance the needle towards the nerve. What I'm feeling for is a little notch within the eye socket that you have a little notch. That's where the supraorbital nerve lands. Same thing. Numbing the skin first, advancing the needle right before injection, aspirate, and I am blocking the medial side first, and then I'm gonna block the lateral side. So each time when I inject, right before I inject, I aspirate, just because I don't want this lidocaine going in the vein or artery. That's how we determine by aspirating. So it's the same concept that we use when we're injecting filler in the lip. We never want to occlude vein or artery. You do have a lot of veins, arteries in your face, even though it's small, but you never know. As you can see, we block the skin first, then advance the needle and aspirate and inject. Now I'm feeling for temporal artery that runs through that, and you are injecting in the auriculotemporal nerve. I felt for the artery, and I am aiming 1 to 2 centimeter away from that area. So now, as you can see, there was a little, when I aspirated, I didn't have any blood return. And after I pulled out the needle, you can see little blood. That is normal. It's because when I went into that area, I accidentally or inadvertently punctured little vein or artery. So there was no more bleeding, just a little bleeding. So we put a pressure on there, and that will stop. So that's where I'm putting my finger, where the artery is. So I'm going about 2 to 3 centimeters away from that artery. I numbed the skin and aspirated and injecting 1 to 2 cc. You can possibly inject about 10 cc of lidocaine 2% in total of the scalp block. The scalp block takes about 10 minutes, and I have the patient wait about 10 minutes before I start injecting the PRP. So now I am going to block lesser occipital nerve and greater occipital nerve. I have the patient laying prone, and I measure basically the distance between the ear until the occipital bone, and we cut that in two separate places. That's where the greater and the lesser occipital nerves are. So we inject, and again, numbing the skin, then going in, aspirating, injecting 2 to 3 centimeter. As you can see, it does not take long time, and it makes the PRP procedure so much easier. So let's talk about PRP and NAD. The reason I combine PRP and NAD is combined therapy, tissue regeneration, and bringing in your growth factors. So now I test the scalp for areas that is sensitive. So it looks like this area, right scalp, was more sensitive to the client, and I was able to inject a little more local on the right supraorbital nerve. Now here you go. I am injecting the PRP now. Looks like patient was very comfortable. But wait, there's more. We offer other incredible treatments to help you look and feel absolute your best. Imagine saying farewell to those pesky wrinkles with our top-notch Botox treatments. Picture enhancing your features and restoring volume with your expertly administered fillers. Let's not forget our famous EndoLift, so the non-surgical facelift that will leave you looking absolutely radiant. And guess what? We're constantly expanding our services to provide you with even more options to enhance your beauty and your well-being. Soon we'll be introducing hormone replacement therapy to help you optimize your vitality and reclaim your zest for life. Now, here's what I want you to do. If you're excited as I am about these incredible options, incredible transformative power they hold, hit like the button, subscribe to this video, and be sure to follow us on Instagram at KCSF Med Spa for all the latest updates and exclusive contents.